Hello, AlphaFlo friends. This is Kelly, and today I'm here with Dr. Audrey Turbeville from Top Gun Veterinary. Thanks so much for being here, Dr. Audrey.
Hey, Kelly, how are you? Thanks for having us.
So good. Yeah. So today we get to talk about AlphaFlo, and I know you've
Yes,
used it in so many different
I
cases.
have.
And one of my favorites is Nugget. Can you tell us about
Yes.
Nugget?
Yes. So Nugget came to us. He is a 3-year-old poodle intact that showed was in a cage in his pen for the night, was doing fine the day before, and then came to us the next morning completely paralyzed in the back end, dragging the back legs. So the owner was, of course, upset about it. But she fell on some hard times with some financial stuff. So I just had her turn the dog over to me because I was like, we need to really look at this AlphaFlo and we need to see what we can do. This is a prime case. It's an acute case. It just happened. What's going on? Can we help him? And so we did. We took a bunch of x-rays of it. We call it a dog scan, and from the top of his head down to the bottom of his back. And so we looked at certain things, and we showed that he had a couple compressions in his neck. So what I did the first day was we took AlphaFlo and injected it along each side of the spine and the back end and gave him a whole cc IV. And then he stayed in the hospital over the weekend. And then come Monday, we injected another one and cervically up at the neck between C4 and C5. And so between Friday and Monday, during those short period of time, he had already gained use of his back leg. So he was not dragging them. And so he was walking a little bit better. If he turned a little sharp or if he got a little too excited, now he'd flop down on the back side or kind of drag his toes. But the week after we followed up with the second dose on Monday, the whole next week, nothing, it just went through the roof. He is doing fantastic now. They are trying to actually not make him jump. He's trying to go upstairs because he's only 4 pounds. He's a tiny little thing, so he's trying to jump off the bed and trying to go up and down the stairs. And I'm like, you need to quit doing that. But you feel good. I mean, how you gonna make him stop? And so but his quality of life is phenomenal now. So phenomenal.
What great evidence when a dog feels good that they want to jump
Yes.
and run and
Yes.
yeah.
Because before all he would do is just walk a little bit and then stop because he's dragging his feet. And now my brother actually adopted him. So I get to keep a close eye on him. He's got 4 kids in the house, so he doesn't walk that often because everybody's got to hold the baby. And so, but I mean, he is running now and playing, and he's gained weight, and he has done really, really well.
Well, we love your heart to care for and, treat Nugget and find him a great
Yes.
home. Love that.
Yes, we did. We were very fortunate. And the previous owner, she was very fortunate. I mean, I was grateful for her because she just didn't come in and be like, hey, let's just put him to sleep, things like that. And I'm like, hey, let me see what I can do. And she trusted me enough to do that. And then let me inject him with AlphaFlo to see if we could turn him around. And we did. And so
Wow.
I'm very grateful for that.
Wow. We love Nugget's story. And you also worked on a patella on another dog?
Yes. Yep. So we had a dog, and it was a beagle dog. She's about 8 or 9 years old. She lives on a farm. Trying to make her be still is impossible. So we took a bunch of x-rays, and then on palpation, you could feel how the patella was just popping in and out. And so that's been about 2 weeks ago, and I injected the patella ligament and then one of the side ones. We injected those, and then I actually had to go back out on the farm last Friday to check a horse, and she was running around, and I got pictures of that, and I'm like, okay, quit running now. You got to you rest your knee a little bit. But she is actually within a week, 2 weeks, she is actually using the leg is down, she's mobile, no pain, because before she was hollering in pain, and now she's not doing that, and which is great because she's not the best surgery candidate. She's a little older, but she has some GI issues that kind of slow down, so she can get constipated really quick. So anytime you do an animal under anesthesia, that's one of the things that can happen. And so we didn't want to do that again with her. And so this really changed it a lot.
We love that AlphaFlo is a lot less invasive, obviously, than
Yes.
surgery and that
Yeah,
kind of
she is
recovery.
actually my second one I've done. I've done a Frenchie bulldog, and she was a young dog. And so she was just like constantly running around. And so she was three-legged lame. And now to date, because I just talked to her on it this morning, she is doing fantastic.
Wow.
Fantastic.
Do you recommend crating them after they
I
receive a
do.
dose?
I do, because anything, just like anything, it needs to rest. You need to rest it regardless. And I think Alpha Flow will work regardless, but it always does better if you can rest it. You need to rest it. You don't need to be running the back 40. You need to be calm. You need to, it's got to heal just like us. We heal at night because we're asleep. We're being still. Your body heals during that time. So if you can crate them, that is the best thing to do. But that having one crated for a couple of weeks versus having surgery and then crated like 6 to 8 weeks to 3 months, that's phenomenal. That's so much better. And then of course, always, anytime you can do anything and not go under surgery, we try to be as safe as possible. But sometimes a surgery is not possible for some of our candidates. And so this is a fantastic product to have, because what are you going to do? I mean, we got to we got to fix these guys, and we can do this without surgery.
Well, we absolutely love that you're choosing it. And I would think any owner would want to choose this over
Yes.
surgery.
Yes, I would. I
Yeah.
would. So, but
And
yes, we are doing that.
excellent. And then you also had a wound that which
Yes.
AlphaFlo is really known for. Tell us about that.
Yes. So we had a wound that came in, and I was a second veterinarian on board. It had been sutured 3 times. And then it's a non-healing wound. So came into me because they wanted to do another, I think the tilapia. It's a fish, and you put it over the wound, which is still, it's, you got to be under sedation, then you got to be still, and then because you're going to have a graft, it's going to be grafting. And so anyway, the owner came to me and she's like, hey, can you help me? I was like, absolutely, let's try this. And so we got it, we injected it, and when I tell you, the next week we saw a huge difference. Like, because I got a picture every day. And then it didn't take a month, and it was completely closed. And two, it was hard because these owners lived on a 60-acre farm. Keeping her pinned up was going to be hard for them to do. And so I was like, no, she just put a t-shirt on her, cover the wound, because just like anything, when it heals, it itches. So let's try to keep that covered. It was in a spot where she didn't need to be totally immobile. She could move around since it was just on the chest area, but keeping it covered was the best thing to do. So, because it's, she was short enough that if she walked in tall grass, it would mess with it. So, we did that, and the owners were over the moon. No more surgery, no more having to do sutures. She came in one time, she sent me pictures, we did updates, and it was healed within a month and a half.
Wow.
Done.
And do you notice with the wounds, is there less scarring, keloids? Does the hair grow back? Anything
It
else you've
was the
noticed?
keloids is the thing. It was flat as it can be. So I'm really excited about that. And from what I talked to her, probably about a month, 2 months ago, and it's a tiny scar, a very minute scar.
And how about the fur, the hair growing back
Yep,
in?
hair's grown back except for the very central part of it, which I think is phenomenal considering that, she had a good size. It was probably about 2 to 3 inches, and it had been like that for almost 2 months.
Wow.
So that, yeah, for it just to have not even a dime size scar with no hair, that's pretty remarkable.
Yeah, so we're excited that it can work on something 2 months old and even older. We've
Yes,
seen years
yes,
and it can still
yes,
help with scarring.
yes. I'm over the moon to have this product in our office.
Well, we're thrilled that we know you're only just beginning.
Yes,
This product's been used in hundreds of dogs, and we're
yeah,
excited to get to thousands. And we're
yes,
working now with agility and performance dogs,
yes.
which is very exciting.
Yeah, we've done a couple other dogs that I've been giving IV to. Couple of them I've done, well, Nugget was in the spine, so in the muscles. So yes, and I only look for it to go even more because my office has only been open like 6 months, and so I'm looking for it to even take off even more.
And you take it on the road with you as well. We know you
I
travel.
do. Yes, ma'am, I do, because every farm's got a small animal, so we take it with us. We have it always. There is always AlphaFlo here, always.
Excellent. Well, Dr. Audrey, we appreciate all you're doing and your time. We know you're
Thank
super
you.
busy, and we look forward to continuing to follow you and your cases.
Thank you. Hopefully we'll have many more cases come and good success stories.
Absolutely. Thanks so much.
You're welcome. Thank you.